Post-polio syndrome (PPS) is a condition that affects some individuals who have recovered from polio, an infectious disease caused by the polio virus. PPS is characterized by new or worsening muscle weakness and fatigue that can occur years, or even decades, after the initial polio infection. Understanding the causes, symptoms, diagnosis, treatment, and prognosis of PPS is crucial for managing this complex condition. Causes. The exact cause of post-polio syndrome is not fully understood, but several theories have been proposed. Neuronal degeneration. After a polio infection, some motor neurons are damaged or destroyed. The remaining neurons may have sprouted to reconnect with muscle fibers. Reinnervation. Over time, these neurons may become overworked and degenerate, leading to new weakness. Muscle fatigue. The muscles may become fatigued due to the long-term strain on the remaining functional neurons and muscle fibers, resulting in decreased strength and function. Aging. As individuals with a history of polio age, they may experience age-related decline in muscle strength and function, which can be compounded by the effects of the earlier infection. Other factors: psychological stress, physical inactivity, and concurrent health issues may also contribute to the onset of PPS. Symptoms. Symptoms of post-polio syndrome can vary widely among individuals and may include new muscle weakness. This is often asymmetric, affecting previously affected limbs more severely. Fatigue. Persistent and often debilitating fatigue that is disproportionate to activity levels. Muscle atrophy. Decrease in muscle mass, particularly in previously affected muscles. Joint pain. Increased pain in joints due to the strain of compensating for weakened muscles. Cold intolerance. Increased sensitivity to cold in affected limbs. Sleep disturbances, including sleep apnea, which may exacerbate fatigue. Difficulty with daily activities. Challenges in performing tasks that were previously manageable, leading to a decline in quality of life. Diagnosis. Diagnosing post-polio syndrome typically involves medical history, a thorough review of the patient's history, including details of the original polio infection and the development of new symptoms. Physical examination, assessment of muscle strength, reflexes, and physical function. Exclusion of other conditions. Since symptoms of PPS can overlap with other conditions, tests may be performed to rule out other causes of weakness and fatigue, such as blood tests to check for thyroid function, anemia, or other metabolic issues. Imaging studies such as MRI if there is a concern about other neurological conditions. Functional assessments, evaluating the ability to perform daily activities and assessing the impact of symptoms on quality of life. Treatment. There is no cure for post-polio syndrome, but treatment focuses on managing symptoms and improving quality of life. Lifestyle modifications. Energy conservation. Learning to pace activities and conserve energy can help manage fatigue. Assistive devices. Using braces, canes, or other assisted devices to aid mobility and reduce strain on affected muscles. Physical therapy. Tailored exercise programs to improve strength and function without exacerbating fatigue. Gentle stretching and range of motion exercises to maintain flexibility. Pain management. Non-steroidal anti-inflammatory drugs and SAIDs or other pain relief medications as needed. Occupational therapy. Assistance with daily activities and adaptations to the home or workplace to enhance independence. Psychological support. Counseling or support groups to address emotional challenges and improve coping strategies. Medication. In some cases, medications such as antidepressants or medications for neuropathic pain may be prescribed to help with mood or pain. Prognosis. The prognosis for individuals with post-polio syndrome can vary widely. Some individuals experience mild symptoms that do not significantly affect daily life. Others may have more severe symptoms that lead to considerable disability and impact their quality of life. PPS is typically a slowly progressive condition, meaning that symptoms may worsen gradually over time. Regular follow-up with healthcare providers can help manage symptoms effectively and maintain quality of life. Conclusion: post-polio syndrome is a complex and often challenging condition that can arise many years after an individual has recovered from polio. Understanding the symptoms and engaging in a multidisciplinary approach to treatment can help individuals manage their condition and improve their quality of life. If you have a history of polio and are experiencing new or worsening symptoms, it is important to seek medical advice for proper evaluation and management.